Before I get into this video, I want to offer a huge trigger warning to all of you watching. This is going to be my most intense series to date on this channel, perhaps throughout my entire time on YouTube, and I just want to give you a little hint of what's to come before we get too far in. This series, this entire playlist, is going to have topics of doctor's appointments, of gynecology appointments, of surgery and medical problems. I'm going to be discussing things like bowel movements and vomiting and blood and surgery and mental health problems. If you think these are things that are going to trigger you, please, for goodness sakes, do not watch this series. There is no way for me to get around talking about these topics. It's very important to this story. So I'm very sorry if this is something you can't partake in, but there's plenty of other content on my channel. I just wanted to let you know ahead of time.
Now what's the matter?
Hi there, everybody. I apologize if my jacket makes a strange rustling noise tonight. It is a rain jacket and I'm kind of chilly right now, so I chose to keep it on. Tonight's video is extremely difficult and uncomfortable for me. I know that no matter how much I ask for people to be kind and understanding and accepting, there's always going to be those people who don't really feel like it, those people who decide that it's more fun or entertaining to mock someone who's going through something difficult. But I'm doing it anyway, because here I am. And it's taken me a couple of years to gain the courage to make this video. It's hard because in making this video, I'm exposing the most vulnerable and private side of myself. And as a result, I had vowed to myself to never make this video, to never speak out on this topic of my life, because I have been ridiculed for it in real life, and I have been mocked and treated terribly for it in my real life offline, and I didn't want to have to go through that again. So I remember at one point early in my YouTube channel, I even said, I'm never going to make a video about this, you'll never see it, so don't plan on it. The reason I changed my mind, even though it is hard, so you'll have to bear with me pausing a lot or having a hard time, is because I know quite a few people in the trans community, and when I say trans community during this playlist, I don't just mean people who are fully trans, I mean anyone under that non-binary umbrella, literally anybody who doesn't fully identify as the gender they were assigned at birth. Just want to make that very clear. It's just easier to just say trans instead. I know a lot of people who are in the trans community, and if they are FTM, it's extremely difficult for them to have a uterus because, let's face it, more so than pretty much anything, a uterus is what inherently makes you feel female. And if you're a trans man, you don't want to feel female. It's very uncomfortable. It's not nice. For the most part, even if you're pre-surgery or you're not having surgery and you've decided to do things like use a packer and a binder and stuff, you can kind of get through it somewhat. It's not perfect, it's not quite the same as surgery or hormones, but you can at least kind of say, well, at least I look like a man today. But then you get your menstrual cycle and everything goes to shit, because there's nothing more feminine feeling in the world besides maybe pregnancy than menstruating. And there's no getting away from it for some people. Some people are lucky enough that they maybe get like a little tiny squeezy cramp on the first day of it or something, and other than that, you know, their flow's not that bad, they can just kind of get away with no one knowing. Other people, however, have completely debilitating cramps. Some people have dysmenorrhea, and if you don't know what that is, it basically means that you have such incredibly painful periods. You can't even get out of bed most days during it. You're completely bedridden. You can't do anything for yourself. You're double over in pain. Sometimes you're screaming because you're in so much pain until you pass out. It is hellish. It's a horrible thing to go through. Other people have things like endometriosis and fibroids and really bad cysts, and these all make it so that your menstrual cycle is extremely painful and extremely obvious. Not only are you in pain the whole time and holding on to where there's clearly a uterus in you because it swells up and you're pushing down on it just out of, reflex to try to get it to calm down and not hurt so much, but on top of it, you generally end up having a heavier flow than most people. Not 100% of the time, it's not guaranteed, but a lot of people do have a heavier flow when they have these issues, which means that you're constantly stopping whatever activity you're participating in to go and change whatever it is you're using down there. After a while, no matter how manly you try to make yourself seem, people are gonna find out about that. And some people don't want to say that they're trans to people. Maybe they're not ready for those people to know yet, and maybe they'll never be ready. You don't have to do that. You're not obligated to tell people that you're under the trans umbrella. That is your information. It doesn't belong to anyone else. It's a nice idea sometimes, but you certainly don't have to do it. And if you're someone who's not ready to admit it to some people and that's going on, it's really hard. Now, why am I saying this stuff? Well, a lot of the trans men I know want to get rid of that organ. They're like, I'm done with it. I don't want to ever, become pregnant or something, and I don't want to menstruate anymore. I am over it. I can't do this anymore. I do not want that organ in my body. Even tube tying isn't on the table for them. They just want it gone. They hate having it inside them, and I can completely sympathize and understand that. However, there is a lot that goes into a hysterectomy, especially a full hysterectomy where, uterus, ovaries, everything is going. Now, it was a little bit of a perk for me that I needed a hysterectomy, the full thing, and I don't exactly identify as female. I have had some people before on older videos on my channel try to argue with me because I wear makeup, but in response to that, I say, look at Menu MUA, Jeffree Star, James Charles, all these people, are you telling me they're not men? But that's not the reason that I got a hysterectomy. The reason I got it was purely medical. And I'd had doctors in emergency rooms tell me I needed one for years. And I was having the worst trouble finding a surgeon who would actually perform it. And even after I did find one, there is so much information that they don't tell you to prepare you for a hysterectomy. Information that makes things a lot harder during your recovery and a lot harder if you are under that trans umbrella. So I'm not making this video to say if you're trans, don't get a hysterectomy. I'm making it just to say if you're trans, please watch this. And even if you're not and you're thinking of getting a hysterectomy, please watch this, because a lot of the information in this series is stuff that nobody bothered telling me before I went in for it. And as a result, I had a really difficult time. Now, for ease of watching and for me for ease of filming, this video is going to be in at least 3 parts. This first part is going to be all about what you need to prepare for before your surgery. The second one will be during surgery, and the third, of course, will be your recovery. So, time to dive right in. I'm gonna try to put timestamps in the description box below, because in order to help you understand why I got one, I have to kind of go into my medical history, and if that's not something you're interested in hearing about, then you'll be able to just dive right into the surgery stuff. But basically, I've been sick since before I was born. I'm not going to explain any specific diagnoses or anything, because I don't think that's anyone's business, but I will let you know enough to understand why I needed this surgery. I ended up almost miscarrying twice while I was still inside my mom and trying to take her out with me. And after that, after I was born, as a baby, I had a ton of health problems, tons of health problems, to the point where my very first major surgery happened when I was age 2. My first clear memory is of 4 doctors holding me down on a table with a light over me and sticking a needle with me and yelling at me for not sitting still. So that tells you something. Most of my childhood memories are me looking out the window and watching all the other kids have fun and play while I was stuck in my bedroom because I was too sick to do anything. And unfortunately, One of my many ailments was a hereditary problem that my dad's side of the family has, where just about every generation of people who are born biologically female have serious complicated problems down there. They can't figure out why, they just know each generation it gets worse. My great-grandmother had to have a hysterectomy, my grandmother had to have one, then my aunt had to have one, which is the only female that my grandmother gave birth to, and then I had to have one. It's just a weird hereditary thing. And it seems to be a little bit different each time. The first couple times it was that they had really bad endometriosis that wasn't being cleared up or helped by anything else. And then my aunt, who had it right before I did, like 5 years before I did, her issue was that she had fibroids, which are muscle tumors that hurt very badly. I can't even describe the pain you're in if you have them. She also had the fibroid tumors so big that they were causing colitis inside her. And just like me, she'd begged for years and years to have the surgery, and she had trouble getting it until it was almost too late. And then I had extreme endometriosis, which we'll get into more in a little while, and enormous fibroids. So yeah, it's a fun thing. So when I was about 10 or so, my mother had the talk with me where she explained that, like, hey, she had had her first menstrual cycle when she was 11, and she just wanted to make sure I was prepared so I wouldn't be shocked or anything by what I saw. And I was like, okay, like, sounds gross, but yay, you know, it's not like I can do anything about it. During my first menstrual cycle, I actually had to scream for my mother to come into the bathroom because I literally could not stop bleeding. It was just pouring into the toilet and making me feel sick. And on top of that, I was in so much pain that I felt like I was going to throw up. And she was like, okay, you know, people have cramps and stuff during it, and some people bleed a lot, but this is a little unusual. We better watch this. The pain evened out a bit after a while, but the flow was so incredibly intense that I would have to leave class a couple times per hour to change everything because I was making a huge mess. It got to the point where my teacher saw I was trying to skip class, and I actually had to have a doctor write in and say, no, this person's actually really sick and something's wrong with them. Please don't accuse them of that. Then at about age 13 is when things started getting a whole lot worse. At age 13, it got to the point where literally every single time I had my menstrual cycle, every single month, for the first 3 days of it, I would be in so much pain, I would be screaming my head off. And I have a pretty high threshold for pain, despite being chronically ill. I can handle a lot. I handle my dad like accidentally dropping stone bricks on my foot and stuff and didn't make a peep. So that tells you something. I lived on a rescue farm where cows would step on me and crush my toes. Didn't make a sound over that either. This hurt so bad I would scream for 3 days straight. I would be in so much pain I would vomit enough to fill half of a plastic shopping bag, and I would eventually pass out and not wake up for several hours. I couldn't work. I couldn't go to school. I was missing my classes to a point where they weren't going to let me graduate, even though the doctors were like, I'm promising you something's wrong with this person. And so my mother took me to my doctor. Now, my general practitioner at the time was a guy who was an OBGYN. He had a long history of being an OBGYN. He would help with just regular women's health, your yearly exam and stuff, and he also delivered a bunch of babies, so he'd, seen every side of women's health. And she was like, I think it's a good idea to have him check you out because this is getting really concerning. And so we go, and for the better portion of, I've got to say, like 5 years, all he ever wanted to do was give me ultrasounds. And this wasn't like once a year or anything. This was like every couple months he'd be giving me an ultrasound saying, oh, I don't see anything that looks that bad to me. Just take these medications and be gone, pretty much. The medications would make me feel worse. My pain medicine made me throw up, and my anti-nausea medicine made it so the pain medicine didn't work so well no matter what he gave me. So I was like, listen, this isn't working. Like, something's actually wrong. I think we need a deeper scan than the ultrasound because it's coming back too blurry. I don't think you're seeing enough. And he kept arguing. Eventually it got to the point where my mom was like, listen, for 5 years, you've given my kid like 20 ultrasounds. Clearly ultrasounds are not enough. They're not working. You're going to stop. All you're doing is emptying our wallets for no reason. Either do another test or we're out of here. So he finally was like, okay, fine, we'll try birth control, which made me feel like crap because, again, birth control is a very inherently female thing to be on. And you can't disguise it as looking like anything. I mean, they're in this little sleeve on something that says, you know, Monday, Tuesday, Wednesday, and so on all over it. Everyone knows what that pill is. So there was no hiding it. I had to take mine at a specific time. So if I was out with my friends or something, everyone got to see it happen. Not to mention the fact that it's gross, but if you're on birth control, especially in high school, everyone loves pulling the slut card and shaming you and trying to treat you like an outcast or like you're this bad person who must be sleeping around, even if I had been sleeping around, it didn't make me a bad person. It makes no one a bad person. It just makes you, you know, who you are if you like to do that stuff. It just gave people more of a reason to bully me when they already were for everything else I was going through. And then when I was in my late teens and early 20s, I had tried 4 different birth controls, and unfortunately none of them helped me with any of my symptoms. They just seemed to make everything worse. And what I mean by that was, unfortunately, this issue was giving me a lot of serious mental health problems. And I've got the scars to prove that. I made multiple attempts on my life without even remembering it. Like, I'd wake up the next morning and be like, how the hell did I get this, like, huge gash in my arm? How come I'm, you know, puking up pills or something? It was horrible. And I had a doctor say, yeah, like, you've been to therapy and stuff, like, it's nothing just mental health related. Like, this is all related to your hormone imbalance and the fact that you're having all of these, you know, women's health issues. And I was like, well, help me already. Like, nothing's helping, and every time they put me on a different birth control, it's just making all this worse and aggravating it. I need something else. Finally, in 2014, there was a night I woke up at 3 a.m. screaming my head off to the point where my dad ran into my room from the opposite side of the house and had to carry me to the ER because I couldn't even move. I was in so much pain. I was just like crawling across the floor. They were like, we're not doing an ultrasound again, clearly that's not working. They put me in for a full, like, MRI scan, a deeper scan, and that's when they were like, yeah, there's some pretty big ass fibroids in this person, and they're like squashing your, you know, your colon and stuff. And that's where, you know, I'd had a lot of problems with going to the bathroom normally and stuff. I would go like 4 days not, you know, going at all, and then all of a sudden when I did go, it was just like a fucking geyser. And so they were like, that's where that problem's coming from. It looks like you've got at least one in the front, which you could see, you know, on the exterior, and you've got at least one other one in the back. And they were like, on the scan it's showing like 4 centimeters, but it's probably a lot bigger than that, because they were like, I mean, think about the scan, is it's just a photograph, you can only see what's on the very surface, you can't see how deep it's going. And I was like, well, what do? I've tried so many things. And they were like, you're gonna probably have to get a hysterectomy. We think that's the only thing that's gonna help you. Like, you honestly need one. Like, this is bad, that is crushing your colon and stuff. I had 3 different doctors in the ER come in and tell me that exact same thing. So I was like, okay, finally, there's gonna be some form of relief. I'm not gonna have to go through this anymore, because it was getting to the point where it was starting to hurt even outside my menstrual cycle. It was hurting so much I couldn't go to work anymore. It was bad. And it was making all my other health problems a lot more aggravated too. It was setting them off and causing pain flares and stuff. So we go back to my GP and we're like, okay, so had to go to the hospital and stuff, and they really strongly advise, like multiple doctors there, that I get a hysterectomy because they think that's the only way this is going to get solved, especially since these fibroids, according to them versus your charts, seem to be growing all the time. And of course, he's just like, no, you're going to just keep going on different pills. And I was like, we've tried pills for years. Like, they're not working. So, yeah, eventually we decided, well, screw this guy. He won't do what he needs to do for me. He just keeps trying to force all these pills that aren't doing anything good for me on me. I'm not staying with a doctor that isn't helping me. And that's something I want everyone to understand. If you're begging for help and you know what you need in order to do better, or even in order to survive, and your doctor's refusing to give it to you, leave that doctor. When a doctor advises something or advises against something, it's their professional opinion. Keyword is opinion. They can't force you to do or not do anything. At the end of the day, it's your body and your choice. I made the choice to leave this guy because I did not think he was doing what was best for me. So we see this other doctor, who is a female doctor and was extremely good. She was like, well, before we go into anything like that, I want to go into your entire medical history to make sure there's nothing underlying that's causing this stuff to happen in there. So I'm like, okay. For the better portion of a month, she's poring over every medical record from the day I was born to that day in her office. And I loved it because she was like, there's been a history of all these health problems with you. Why has no one diagnosed you with anything officially? Why has no one done anything to help you besides force pills on you? You have chronic hereditary problems. And you can see the pattern from when you were 2 years old to now. How is no one else gone to this? And I was like, because you're the first doctor who's actually asked to see my file like that. Like, most of them just wanted to sit there, talk to me for 10 minutes, give me a medication, and send me on my way. They didn't actually want to do anything to help. I completely forgot to mention that I got to have this female doctor for about a year or so. And during that year, I did better than I had for a while. She never managed to cure or solve any of my problems, but she did listen extremely well, and she did her absolute best to help me however she could. Unfortunately, after that year, she had to quit her practice, and on the last day that she ever saw me, she informed me that the reason she was quitting was because she was part of a network, and that network of doctors demanded that she only spend 10 minutes with each patient, no matter what they were going through. She couldn't go over that 10-minute mark, and every month she was to meet a specific requirement of a certain amount of prescription medications, and she stated that she was uncomfortable with that. She said that it was against her morals to only spend this short amount of time with patients who desperately needed her help and to force medications on them when they didn't need it. So for anyone who wonders where in the world that doctor went, that's what happened to her. Now, before I continue on, why am I saying all this to you? What does my medical history have to do with getting ready to have a hysterectomy? Well, this is one of the things that no one prepared me for. How difficult it is when you know you need a hysterectomy to get a doctor to just sign off on it. It's next to impossible. It took me 15 years to get any doctors to listen to me and to take the advice of the people who saw me in several different hospitals during several different all-night stays, because in their exact words, we don't want to give you a hysterectomy because one day you might decide you want to have kids. Now, I don't think there's ever a good excuse for that, but there certainly isn't if someone writes non-binary or trans man on their medical files when they're filling out your paperwork, and I definitely don't think there's a reason to when someone's in their mid-20s or early 30s. Yeah, when I was like 25, 26, 27, they were still trying to tell me, what if you want to have a baby one day? And I was like, listen, dude, don't you think I've made my peace with the fact that it's never happening by now? And even if I wanted to, there's no fucking way my body's gonna allow that at this point. Now with these giant-ass fibroids growing in me, the kid's gonna be born and get suffocated by a muscle tumor. Like, it's just dangerous, that idea. It's really hard and really frustrating when you absolutely need one, it's medically necessary, and no doctors will just listen to you. It's a huge problem. I have seen women almost die because the doctor just decides it's more important for her to maybe have a child one day than it is to save her life. I've seen stories where women actually did die because of this. It's a problem, and it needs to stop already before more people die or more people get close to death, because that's definitely where I ended up. Now, continuing on, I ended up moving here to where I am now with Phoenix in July of 2017. And my aunt lives about 3 hours away from me. And she had the same problem as me, years and years, trying to tell doctors, you need to help me, something's really wrong, having nobody listen to her, nobody take her seriously. I'd be like, what if you want to have a baby? Even though she had no interest, she can't stand kids. Never had the thought cross her mind. She was like, I don't care, if I ever want one, I'd just adopt, like, it is an option, you know. And finally, she found a doctor here who listened to her and got her the help she needed and got her the hysterectomy. And she was like, I really think you need to see this guy. And I was like, you know, at this point I'll try anything. But, you know, I'd already pretty much resigned myself to, oh, it's just going to be another person who doesn't listen. Even though he listened to her, at that point I was just tired and done. Now, before I got to him, I was literally dying. For 15 years I'd been begging for help, and for 15 years no one had done a single thing to actually help me. All they did was try to force expensive medications on me that made me feel like crap and did nothing to solve the problem. And as a result, the fibroids and the endo had gotten so out of control, I would go to the bathroom maybe once a week, and it wasn't a lot. I was dropping like 12 pounds a week to the point where I looked like a frigging skeleton. I was just getting smaller and smaller because I couldn't eat because I was getting so backed up. And I was in so much pain, all I could do was lay on the couch for a long time. I'd have the odd good day here and there where I might be able to go out into the barn and hang out with the animals, but they were few and far between. I had no life. And at one point I was just laying on my mom's couch, looking depressed, looking bony with my sunken in cheeks and stuff. And she was like, what do you need from me and what's going on? And I just looked her in the eye and I said, Mom, I think I'm dying. And she was like, why do you think that? I was like, nothing inside feels right. I keep going in and out of consciousness. I would try to walk 2 steps with forearm crutches and just collapse and pass out. I could not function. My heart was always fluttering and palpitating to the point where I would have, you know, visual blackouts and start hyperventilating. Nothing felt right anymore. It felt like everything was slowly shutting down. And I was like, I am so scared. And this was like a little bit before I moved, and then the same thing happened after I moved, where there were several instances where we would just be, you know, out and about, just shopping or something, and I would just collapse and just be like in her arms, and she'd be like, it was so terrifying. I mean, there's pictures of me where I am sheet white. Her mother, Phoenix's mother, used to ask me why I wore white foundation, and I was like, I don't wear foundation. I was like, I'm not wearing foundation. And I had to prove it by like having someone go like this on my face and go, look, there's nothing there. And yeah, that's how bad it was. I was literally sheet white, and people who have seen the pictures of me from that point are like, it's fucking scary. I went and saw the doctor who worked on my aunt in September of 2017. I was laying down on the table because I couldn't even lift myself up into a sitting position unless there was an arch to the chair. And he came in, he was like, you look like you're 5 months pregnant. And I was like, I know. He was like, you are so incredibly swollen. I know. And he was like, what happened? And I was like, what happened was for 15 years, I didn't get any help. I've been begging and no one's doing anything. And I started just breaking down in this guy's office, and he's like, it's gonna be okay. I'm gonna give you a once over, like Phoenix can stay in the room with you and stuff, it's gonna be alright. He barely touches me and I'm like trying not to scream because it hurts so bad. And I'm like, yeah, everyone just says I'm too sensitive and stuff, and that it's just because I need to have a baby. And I don't know why having a baby will suddenly solve all these problems. Like, inside and outside, I was really sensitive. If I tried to, be with my partner and anyone tried to put anything inside, you get like that much of a finger in and I would fucking scream because it hurt so bad. If you touched where my uterus was on the outside, it hurt like crazy. I couldn't handle the slightest bit of pressure because of the pain. And he was just like going like this. And he sat down, he took some notes, and then he was like, I have a question for you. And I was like, all right, ask away. And he said, what do you want me to do? And I said, 100% transparency? I want this thing out of me. I'm done with it. I don't want to have kids. I don't want this in me hurting me all the time. And I don't want people to keep having an excuse to purposely misgender me. I'm done with all of it. And he was like, all right. He was like, I can't understand why when you're nearly 30 years old, people still think you can't decide whether or not you want to have a child. Obviously, you're more than old enough to know that. And he was like, the next thing you need to do is we need to make sure your insurance is going to be willing to provide you with this surgery. This is another thing they don't usually tell you about a hysterectomy. Your insurance will do anything to wiggle out of paying for a hysterectomy. A normal laparoscopic hysterectomy that is easy, just kind of push it out through the vag and stuff like you're having a baby and be done with it, easy peasy, can already run you 10 grand or more. Not including the anesthesia, not including any complications that could happen. That's not something most people can afford, so you need your insurance to help you. Well, he was like, in order to even have a hope of your insurance wanting to cover any of this, you're going to have to go through a regular yearly exam from a gynecologist. You're going to have a transvaginal ultrasound to show at least kind of a hint of what's going on so I can show them that you medically need this to happen. And you are going to need to do a handwritten letter detailing your whole history of why this is a problem and why it's medically necessary for you to have this surgery, and then you're going to have that letter notarized. All of this just to be permitted by the insurance to get this surgery. And that was extremely hard. I was getting very mentally triggered trying to handwrite this note about like, oh, since I was 11, I've had to deal with this nonstop. Yeah, I have to sit there and reread through it several times, making sure that I've proven several times over in the handwritten letter that I deserve to be saved. Then I had to go to the freaking UPS store and have this girl I've never met before read my entire medical history and sign off on it. And then tell me like, oh, good luck with that, while I see every employee looking over like, ooh, what's that person going through right now? That's not fun. Then I had to have the ultrasound, which was one of the most painful experiences of my entire life to date, because like I said, even half an inch going in there hurt enough. Now I've got a probe going all the way into it, pushing past tumors and stuff. It fucking hurt. I was screaming into a towel. The poor girl administering the ultrasound felt horrible and kept on apologizing to me the whole time. And I was like, don't stop, just get it over with. Like, I just want it done already. And then this is the kicker. So 2 weeks before I was due for the surgery, I had that lovely yearly exam. This is a guy who had pictures of all the babies he's delivered all over his wall. He sits there and he, spreads and he looks in there and he says, oh, everything looks fine in there. And he knew what I was in for. He asked before I came in, he's like, so is this just your yearly? And I said, no, actually in 2 weeks I'm due to have a full hysterectomy and I need to make sure that it's going to be medically possible and nothing, bad will happen that could kill me or something. So he knew I was there for a hysterectomy and he said, oh, everything looks fine down there, no big deal. I told my surgeon that, and he was like, wait, he said what? And I'm like, yeah, he like spread apart and looked and said everything looked fine in there. And he was like, you can clearly see one of the tumors as soon as you look in there. What do you mean he thought nothing was wrong? And I'm like, that's what he told me. And he's like, that's scary. This man is delivering babies all the time, and he couldn't notice that that looked wrong? So, yeah, I was like, I don't know. So, a couple days before the surgery, I had to go in and see my surgeon again. He looked over all my paperwork, he made sure everything was in order, that it was ready to be sent off to my insurance company, and he got me ready for what was to come. And he was like, okay, so here's what to expect. The day before surgery, no eating or drinking anything, and you're gonna have to wash yourself with this, special cleanser. It doesn't hurt or anything. It's not, like you're rubbing straight alcohol that hurts or anything. You don't feel anything, but you have to shower and you have to clean pretty much your whole body with this special soap. And he was like, I know it's going to be hard, but do your best to sleep. You're going to come in at 5 in the morning. They're going to talk to you, and then you're going to get carted back. So I'm like, okay. Now, because the surgery was 3 hours away, obviously I was going to have to stay in a hotel with Phoenix because it was just going to be too hard to drive that early. We'd have been basically not sleeping the whole night before surgery. And he was like, it's going to be hard, but we're going to try to make you as stress-free as possible because we don't want anything to go wrong. So my mother decided that she wanted to come down for it because I wanted at least one parent there, not just for me, but for Phoenix too, because a lot of people feel bad for you as the person getting the surgery, and I understand it because it's pretty traumatic. It's a hard surgery to go through. And everyone seems to forget your partner is the one who day after day is taking care of you. Your partner is the one trying to get food into you when you can't eat. Your partner is the one trying to give you fluids and carry you to the bathroom and wash you because you can't shower by yourself. Phoenix did so much for me. She would hold me when she thought I was dying and stuff. She would fight for me when people tried to say I was just exaggerating for attention or that I was faking it. She was there for so many traumatic moments. And people weren't checking on her. And I was like, listen, I'm going through a lot, yes, but so is she. She has to see the person she loves most in this entire world dealing with this stuff, all the while knowing there's not a single thing she can do to fix it. That's hard. So I was like, I just need you and my aunt to be here to take care of her, to make sure she's doing okay, because this is going to be really hard for her. So they all decided to come. It's the day before the surgery. We all check into a hotel like a few minutes away from the hospital. I, don't eat or drink. I make sure that I clean myself up with that special soap. And until like 1, 2 in the morning, I'm just laying there like, and it's funny because like I've been, like I said, through multiple surgeries, some just, in office and some pretty serious, but this was different. I mean, even during the other major surgeries, I kind of had an idea of the outcome. I knew that everything would be fine. This was different because this was the most serious problem I'd had in my life. So I was like, I don't know what to expect. I don't know what's going to happen during this. So we get up, and at 5 a.m. I check in. They have to have you fill out some paperwork, and you have to sit there for like half an hour just hopping there like, I'm so freaked out, just take me back already. The anxiety is intense. Even if you're like me and you practice deep breathing and meditation, there's just no getting around how anxious you're going to be. It's going to be one of the scariest points in your entire life when you're sitting in that waiting room knowing that they're going to do that to you and you're just sitting there waiting. A half hour feels like 300 years when you're sitting there watching the clock. And finally somebody comes back and they're just like, are you so and so? And I'm like, yes. Are you here for this? Yes. And they're like, okay, you're coming back with us. And I'm like, oh, am I going alone? They're like, yeah, your partner and your mother have to stay in the lobby from here on out. You're just going to be back here with us. And I'm like, okay, goodbye guys. They're like, don't worry, like right before the surgery starts, you can see them and they can, you know, wish you luck and stuff, but for the next hour, you're gonna be alone with just a couple of the nurses. So I'm like, okay. So they wheel me back and they're like, okay, you need to take everything off apart from, you know, your little gown that you're going to be in to cart you back. We're going to have heated blankets on you and make you as comfortable as we can. And I was like, okay. And they're like, yeah, we're sorry we had to bring you in so early, but we want to give patients, you know, about 2 or 3 hours to calm down, to rest, relax, get to know the staff, and go in as stress-free as possible, which I really appreciated because I was like, I don't want to be up at the butt crack of dawn just panicking my way into surgery. So they sit me down and they make sure that, you know, I don't have a problem with the anesthesia and stuff. I talked to the anesthesiologist. I'm like, oh yeah, I've been under a bunch of times. I've never had any problems. It's so easy for me that like right after I wake up, I can carry on a full-blown conversation. So I was like, you shouldn't have any issue with that. And they're like, ah, awesome. And are you worried about anything? I'm like, no, I'm just, you know, I'm ready to go. I just want it out already. And they're like, yeah, we can't blame you from what we've seen. Then I have the girl come in who's supposed to give me the IV, and she puts in, she was amazing at it, and she's just letting me know, like, yeah, you're gonna have the IV in the whole time. It's gonna not only keep you under, but it's also gonna give you some pain medications, because we obviously, you know, on the very slim chance you woke up during surgery, we don't want you to be hurting or anything, but they're like, don't worry, like, you shouldn't be, and they explained it. This is another thing a lot of people don't know because they don't tell you until you're in that room getting ready for surgery. They were like, when you're under, you're not going to be like completely out. You're going to be in what we call the twilight state. And what that means is they put you under enough you can't see anything. Your eyes are closed like you're, you know, you look like you're sleeping. You can't feel anything, but it's like when you're in that in-between space at night where you're like almost asleep, but if someone makes a noise or something, you're like, what was that? You know, like you're not quite there yet. That's where you are when you're under for that surgery. So I remember like some little tiny hints of conversations and stuff, and it sounded really far away. I likened it to sounding like you're underwater in a swimming pool trying to listen to the people who aren't underwater. It's very strange. So you're like not exactly conscious, but you kind of remember hearing voices and stuff. So they explained that that was going to happen, and they were like, don't worry about it. I know that sounds really scary, but it's not going to be at all. You won't see anything. Everything's going to be fine. You won't even remember what anything you heard was, and it's true. I don't remember exactly what anyone said. And then they were like, so your mother and your partner can come back now. We'll explain all this to them too, which they did. They kept them very in the loop, which was really nice. If it doesn't seem like the people you came with are gonna stay in the loop, make sure that before you get carted back for the actual surgery, you say, I really want you to explain all this to them. I don't want them to not have an idea of what's going on with me. Because them not talking to your partner or your parent or whoever it is that's with you doesn't necessarily mean they're being dishonest or that they're, you know, being unprofessional. You have to remember, you're not that person's only surgery that day. They go through a lot all day long, and someone might be in even more dire straits than you, so they're just busy, and sometimes, you know, they're human. They make mistakes. They forget. So just if it seems like something like that's going on, just politely ask them to keep that person in the loop. They let me have about an hour with them. I was allowed to leave my bags of personal items with them, which made me feel a lot better than keeping it in a locker or something where something could potentially happen to it. So that was nice. And they told me, okay, we're ready to cart you back. We're going to have your surgeon come in. He's going to take you to the operating room, and we're going to give you one more briefing before you actually get put under. And I was like, okay. So my surgeon comes in, and he was very upbeat, very positive, very nice with me to, you know, kind of keep my spirits up. He rolled me back. He's just like, meet Dr. blah, blah, and blah. They're all going to be here as part of the surgery. I'm like, oh, hi, everybody. Like, good to meet you. Wish it was under nicer circumstances, and making jokes with them and stuff. And then he laid me down, and he's like, before I put the mask on you, there's something I want to let you know. And he said, my goal is to just basically make 2 tiny little incisions and to kind of push the uterus and ovaries down and kind of out through the hole. He's like, usually that's how it goes. It's usually very easy, and generally speaking, it's nice enough that with some pain medication, you can go home, you know, a few hours after surgery. He was like, being that you live 3 hours away, I'm going to keep you overnight, just, you know, so you're not all body stressed and stuff, but after that, you should be fine. He was like, but I'm not going to guarantee anything. That's how I would like the surgery to go. However, given how crazy things have gotten in there and the fact that for 15 years you weren't helped with this, I don't know what's actually going to happen. His exact words were, I don't know what's going to happen once I get in there. I know what I'd like to happen, but I don't know. And I'm not going to be dishonest and tell you that I know for sure that this is going to go well. But I'm going to do the best that I can for you. So I was like, okay, I'm ready. Puts the mask on. It smells like when you're at the dentist getting laughing gas and he's just like, count back from 10. I think I only got to like 7 and I was out like a lamp. And that was all my pre-surgery stuff. I know it was probably intense to get through. It wasn't fun for me to talk about. Like I said, it's not a fun subject for me. It was a very difficult time in my life. It's not fun to relive, but if this helped even one person, I think it's absolutely worth it. And I hope it did. I hope that this helped some of you who are considering it or who have had trouble like I did getting people to take you seriously. Just keep trying. Eventually you will find someone who will help you. And it's just hard sometimes, and like I said, one of the worst parts of it is that it kind of gives people this disgusting excuse to purposely misgender you and stuff and decide for you who you are because you're going through these problems, and it's nasty. And in the next video, I'll be discussing what happened during my surgery, because that's more stuff that a lot of people are not made completely aware of that I think is extremely important. So I'll see you during the next one, hopefully filmed next week. And as always, do something that makes you happy, no matter what anyone else thinks about it, and I'll see all of you again soon.